Contact tracing in Essex has been extended to a primary school in Pilgrim's Hatch as targeted testing gets underway following discovery of an Omicron coronavirus case. KFC customers at a certain shop and a church congregation are among those being encouraged to get a PCR swab. Dr. Mike Gogarty is the Director of Public Health for Essex and joins me now. Good to see you, Doctor. How worried should we be?
Good afternoon. So I think we need to take appropriate precautions at the moment because there's so much we don't know about this particular variant. So I don't think we should be any more worried in Essex or Brentwood than anywhere else, really in the world, as well as certainly in the country. We don't know much about this yet. It does appear that it can the variant can transmit quickly. There's some features about it that suggest it might dodge the vaccine to some extent, and we don't know how serious it is if you get it, how ill you get when you get it. We have a case in Essex. That case is unwell, but we hope they'll make a full recovery, and our best wishes are with them and the family. We expect them to recover fully. And we've been very, very precautionary in terms of the extent to which you try to track people who might be in contact with them during the period where they'd be infectious. So the three sites that you mentioned, the KFC in Brentwood, the church and the Lochwood School, are the sites that we feel people are remotely at higher risk, but are at high risk, and it's worth them getting testing because you really want to stop this thing from spreading if you possibly can.
How likely do you think it is that it's more widespread than one case in the county?
Oh, I think there's no doubt that there's more cases in the country, elsewhere, perhaps even in Essex elsewhere. I think there will be more cases emerging over coming days. I've got no doubt about that. But whether there'll be any linked to this, I'm less clear about.
The case in Essex, is it linked to travel from South Africa?
So the case in Essex is linked, but the person themselves did not travel to South Africa. So they were in contact with somebody who's in contact with somebody who travelled from South Africa. But there's a very clear line back to that travel, so we can trace it to travel through South Africa to another African country, actually.
If you live in Brentwood or nearby Billericay or anywhere around, should you be doing anything different at the moment?
You shouldn't be doing anything different, but you should be really sort of, I guess, stepping up in those precautionary measures, not just in Billericay or Brentwood, but generally in Essex and guess wider afield. If you're offered a booster, you must have the booster, because even if this thing dodges the vaccine, it'll only dodge the vaccine somewhat, and the vaccine will help a bit. Now, the more vaccine you've got in you, the stronger your immune system, the better you'll be able to deal with it, and the less likely you are to be severely ill. So absolutely get that booster. It's more important than ever. If you must go out, wear a mask. Try and keep without 2 meters of people. You don't have to get in 2 meters. Try and keep that sort of social distancing where you can. Rethink your personal space. Wash your hands frequently, as suggested. Keep windows open and get ventilated well. And you don't have to hug people or shake hands. You want to hug your family, but you don't have to hug strangers or people in the pub or what have you. And you don't have to shake hands. So I think just taking those precautionary approaches, bearing in mind that the COVID is still out there, and behaving accordingly is really important. But otherwise, go about doing what you need to do and want to do.
We've seen measures introduced by the government, mostly masks in public transport and in shops. Would you like to see that go further?
Well, I'm very keen on sort of minimising risk, but that's my job, isn't it? And the government have got to balance a lot more things. But yes, I would be happy to see as many restrictions in place as are reasonable. If people can work from home, I can see no reason why they shouldn't choose to work from home at the moment, if that's able, because I think that'll reduce again the spread a little bit, and every little bit helps. But the most important thing, I think, is get that booster. That's really, really critical.
And keeping on top of testing with lateral flows?
Absolutely. Twice weekly lateral flows for everybody. Thank you for raising that. That's really important as well. But government are pushing that. But again, I would very much stress twice weekly lateral flows are really helpful. You'll be able to identify if you're at risk, and most important, you can protect others.
Children have got to wear masks in communal spaces in schools at the moment. What is the difference, do you think, Doctor, between a child in a corridor and a child in a busy classroom?
The difficulty is they're mixing with a much wider group in the corridors. They're passing all sorts of people. Also, it's much harder to learn when you're wearing a mask than it is to just walk around the place. So I think if you're sitting in a classroom at one place, the numbers of people near you are lower. But it's really hard to work with a mask in a classroom for a child.
There is a bit of a feeling amongst the public, which is they locked down, they got the vaccine, maybe they've even got the booster jab. They've been promised normality again. Along comes another variant. They did everything they were told to do, and yet we've got it. And we're just going to keep seeing these new variants. Lots of people today, Doctor, are asking, why can't we just get on with it?
Yeah, so you said it yourself. I mean, this is a potentially very dangerous variant. Unfortunately, it's the nature of this virus that it mutates, that it changes, that it keeps challenging us. It is very difficult for people, but we do have to continue to sort of step up our measures, unless things could get really bad again. We don't want to go back to how bad things were last year. We don't want to see loads of people dying of this terrible disease. So I think it's really important, at least for the time being, that we take these precautions extraordinarily seriously. And if this thing does turn out to be very strongly resistant to the vaccines, and it spreads very quickly, and it causes people to be very, very ill, then I think we may be in a place where we have to look at more restrictions again.
I suppose the question is, where does this end? Will we be doing this forevermore?
I sincerely hope not. I sincerely hope that we will find that the thing will stop mutating, and that it'll find a mutation that's sort of fairly stable, and we will get ahead in terms of multivalent vaccines that can work against lots of different sources. But I think for a while this may be a pattern. Lastly,
Doctor, have you got plans for Christmas?
I have got plans for Christmas. Like everyone else, I had a pretty rubbish Christmas last year. I've got plans for this Christmas, including going to some quite crowded places, and I'm really looking forward to still doing them. I hope that'll all go ahead.
Thanks for your time.
Thank you. Cheers now.